Hello, I'm Dr. Sue
Dr. Kardashian.
here at Artlipo, Lipedema, and Liposuction Surgery. Today we're going to talk a little bit about who's the best surgeon for you, because it's not always going to be the same surgeon. And when I say who's the best surgeon, I'm talking about techniques in general, okay? So at Artlipo, we do everything fully awake with just local anesthetic. I give patients 1 tablet of Percocet at the beginning, and that's to control a little of the pain that comes on after liposuction, but there's nothing to zone you out, to relax you, because Percocet doesn't really relax you. So it's just numbing the area. And this allows our technique, which is the interactive lipo technique, tensing your muscle, holding yourself in positions of all different types. It's very dynamic. You have to hold it like this. You got to pull your toes up. I'm saying tight, tight, tight muscles throughout the entire thing. And that's our technique. But when it comes down to your choice of different doctors, there's doctors that, typically they don't do muscle tightening. That's my technique. Almost no other doctors do muscle tensing. So they just have you on the table. They may do it with local anesthetic only. They may do it with local anesthetic with a zoning you out, like a relaxing injection. They may do it under general anesthesia. In today's video, I really want to help you, kind of guide you where you should, what you should be looking for. So we'll categorize it into small, medium, large type of patients and what your goals are. The large patient, really large patient who needs a lot of volume removed and wants it done in 1 or 2 surgeries, really needs to go under general anesthesia. If you're 250 or above and you've got really large legs, and let's just talk about the legs. If you want that done in 1 surgery or 2 surgeries, you have to have it done, or the best way to have it done is under general, because you're asleep. You don't want to be awake for a huge surgery like that. And by the time the surgery is done in a large surgery, you're going to have management of a number of things. You're going to need to be in the hospital because doing that much removal is trauma, and you're going to need to be watched for safety reasons. You may need lots of IV fluids. You may need your labs checked to see if your blood count has dropped. We know that when you remove that much fat, your blood volume is going to be dropped to a point where you may need a blood transfusion. And that's not a complication. That's an expectation of that type of surgery.
Yes. And these surgeries are not as safe, but they achieve results. And their safety factor comes in with general anesthetic. And our anesthesia colleagues are great, but anytime you add an extra layer of complexity, there are complications.
Yeah, they're not as safe. Now, the doctor's still going to tell you, well, we have risks. And all surgeries, even the awake local anesthetic has some risks, but they just say, I'm not going to say they're not safe. I'm going to say the risks are higher. Yeah, I listened to a lecture at the International Congress of Lipedema, and the anesthesiologist in Germany talking about how they had to, oh my God, we watch this, we watch that factor, we watch this lab, the things that she's talking about watching, I'm like, holy crap, that's a lot of things to be concerned about, because they do really large surgeries in a very short time period, the entire leg, and so a lot of factors that can come into the safety. Now, if you are a larger patient, and I'm going to also say older patient, sometimes, the management in a hospital setting is important. We don't do that. We keep it small areas, smaller volumes, which is 4 liters or less, and we can usually do our surgeries in 2 parts, maybe 3, but we don't take on the largest patients. So hopefully that kind of makes sense. Larger patients need a different level of care. And I would never suggest that a really large patient come and do 4 or 5 surgeries with me. And that's mainly because of cost, okay? Surgeries are expensive. And when they do a lot at one time under general, it can be done cheaper, okay? So those are real world concerns. Let's talk about not doing under general in large cases, but okay, Now you have a choice of us, you, and several of other very experienced lipedema surgeons who specialize in this, have been doing it for a long time. There's at least half a dozen other doctors in this country that have been doing it as long as I have, 10 years or even a little bit longer than I have. They have a lot of experience. And in general, those doctors are more expensive because of the care that they deliver, the expertise they've had to develop over a long time period. And we all had to learn our own method. There's no school that taught any of us how to do liposuction in a circumferential manner and, you know, for the full leg, full arms, and everyone has their own techniques. And so if we break down this other part, it's about, okay, how do I choose between Dr. Sue and his interactive technique where you're tight, 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 and it's like a boot camp, versus the other doctor where you go and you relax and you get kind of put under and everything's nice. Or there's the very specialized technique by Dr. Jamie Schwartz, who, you know, he seems to be, you know, a very specialized technique where he squeezes fat out afterwards. Who is good for what surgery? And I think our technique really shines because of our meticulousness that we can deliver for the cosmetic result. If you're not as concerned about the cosmetic result, the next most important thing to consider is how complete is the surgery. So you want a doctor that's removing as much as possible and doing it safely, because when you get down to the last little bits of fat, arguably there is more risk to the skin and injury to the skin and maybe underlying structures when you try to go to the very extremes. So there's a balance of, you know, those two things. But if you remove fat more completely, you're going to have a more lasting result. If you only remove fat 50%, okay? When I say 50%, there's a layer of fat. And when you take it down 50%, you still have a layer of fat there. And that fat can regrow and enlarge again. The less fat you leave behind, the less chance that that's going to happen. So the biggest thing that you should consider as a potential patient is, how complete is the doctor removing my fat? And you know what? No one has a ultrasonic measurement or a gauge to say, oh, it's this percentage. And no doctor is going to sit there and tell you an exact amount. Oh, I tell everybody about 80%. It may be 70% up to 90%, but roughly about 80%. But I can tell you a lot of doctors only take about 50%. And that's just not the best way to do things for lipedema patients. In fact, most of the doctors that come from a cosmetic background, plastic surgery, they're used to taking 50%, sometimes less, of whatever area they're working on. And although that may make some cosmetic difference, it's not a huge cosmetic difference. When you get 80%, it's down to where you are kind of on top of muscle. So that's what to consider. Some of the techniques out there and doctors performing them can get you pretty complete, but yet they're not delivering the best results. And I'm going to say the reason why is because they're not getting the last little bits around the knee. They're also not getting it as completely around the ankle cuff, which is very difficult. They're not getting as completely around the back of the calf. These are some areas that are very difficult, I know, because, you know, I've made, you know, it my passion and my life's work to be able to show all of these little specific areas as completely and beautifully as possible. And I can spot it from a mile away what the other doctor didn't do to get that result. And it's usually because of those areas that maybe, you know, 30, 40% of that fat was left behind in those areas. So you can still get a great relief of your lipedema symptoms from any doctor that's doing things more completely. But if the cosmetic outcome isn't as important to you, wonderful. There's a lot of doctors that offer this surgery at a lower price point. And ours is high. Ours is, you know, comparable with several of the doctors that have been doing this for the longest period of time. And yes, we are more expensive, but there's a reason for that. It's our experience and it's our results. So you got to determine what's more important, the symptom relief, or is it symptom relief and cosmetic improvement? And that's how I'm going to leave it there. Do you have anything to?
Cosmetics, yes, cosmetics is where we shine, and that premium is the price of the excellent cosmetic result that patients are happy about.
Yeah.
Crying, looking at themselves in the mirror and crying with tears of joy because of the results that they get.
Yeah. And if cost is a consideration, Dr. Kardashian joining us is a wonderful thing. He's already delivering fantastic results. And we have 2 levels of pricing. My pricing, which has always been there, but as Dr. Kardashian's coming in, he's proving himself to you guys. And he's already delivering great results, which you can see in the videos of all the patients that he treats. But we're keeping his price point, it's significantly less. And that's to allow you guys to have an opportunity for excellent care at a different price point. But this is going to be for the early period of, until his schedule gets really busy. So take advantage of that if it's important for you to have the best work at, a little bit of a discount. So thank you very much. And hopefully that helps define, where you should be looking. Big patient, I'd like to say Dr. Volstein's a great, a great doctor to take a large volume and, at the same time, keep you in the hospital, watch you and keep you safe. There's a lot of other great doctors here in the country that can help you with your lipedema symptoms. But if you want the best cosmetic results, come see us. Okay. Thank you very much. Bye-bye.